Hey everyone, today we'll be doing a postural analysis. So we're going to start with the side view. And from this side view, we're going to add a plumb line along the whole body and check to see if there's any parts of the body that are forward or behind the lines. Just anything in the head, upper body, shoulders, pelvis, or knees. From there, we're going to check the ankle, and we're going to examine the angle of the ankle joint created by the front of the shin and of the foot to assess and see if anything's plantar flexed or dorsiflexed. From there, we're going to look at our knees, and we're going to use the greater trochanter and the lateral malleolus and relate it to the plumb line. And we're going to look if it's hyperextended or flexed. From here, we're going to check our hips from the ASIS to the PSIS, find the midpoint, and we're going to compare it. Next up, we're going to look at the thoracic and lumbar spine. We're looking for any lordotic or kyphotic curves or flatness. From there, we're going to check our cervical spine, our C1 to C7. We're going to get an idea of that curvature as well. Then we're going to transition to the head, and here we're just going to look and see if it's a little bit forward or a little bit back, extended or flexed, looking up or looking down. So from the front view, we're going to start with the feet and distinguish where the weight is distributed in the foot to see if there's any inversion or eversion. Then we're going to head over to the knees and check the alignment of the femur and the tibia. Worth noting, the feet should be together for this. Then we're going to head over to the pelvis. We're going to check each ASIS and compare the two, and we're going to check to see if they're parallel to the floor. From there, we're going to head on over to the rib cage. We're going to start from the ASIS and go to the rib cage and compare the two. We're going to check for any rotation by looking at the sternum as well. Next up, we're going to head over to the shoulders, and we're just going to palpate along the clavicle to the acromion process, and we're going to compare to see if there's any elevation or depression. Then we're going to head over to the head, and we're going to examine the alignment of the cranium on the cervical spine, checking to see if there's any tilting, shifting, or rotation. And finally, from the back view, once again, we are going to start at the feet and look at where the weight is distributed throughout the foot, to see if there's any inversion or eversion. We are also going to examine the common calcaneal tendons while we're here. From here, we're going to look at the femurs, and we're going to palpate the femoral condyle to see if there's any medial or lateral rotation in the femur. Next up, we're going to palpate each PSIS and compare it, and we're going to check the top of the iliac crest with the hands to see if it's parallel to the floor. Here we're looking to see if they're level, elevated, or if there's any rotation. From here, we're going to check the scapula. We're going to palpate the inferior, superior, and medial border, and we're going to compare the distance to the spinous process. We're looking to see if there's any protraction, retraction, elevation, depression, or rotation or winging. Then we're going to check the alignment of the spine. We're looking for any lateral flexion here. Finally, we're going to check the humerus. We're going to palpate the olecranon process and look for any medial rotation. So for the results, my weight tends to be distributed on the outer edge of my heel. My right hip is elevated, and I have a slight counterclockwise rotation throughout the pelvis. My left shoulder was elevated a little bit, and both my shoulders were slightly protracted. My humerus have slight medial rotation, and my head is forward. This posture is a result of past injuries and prolonged time at a desk doing assignments. So the first FMS assessment that we're going to do is the deep squat. This one's good. It's a coordinated movement requiring a lot of neuromuscular control, and it uses the pelvis, the core, and both upper and lower extremities. What we're looking for is that the trunk maintains an upright position or is parallel with the tibia. We want the femur to be below parallel. We want the dowel to be in line with the feet, and then we don't want the knees to be inside of the toes. So the second FMS assessment that we're going to do is the inline lunge. Basically, this is measuring the body's ability to decelerate, maintain stability and balance, as well as measure the lower extremities, all the joints' mobility. With this test, we want to make sure that the dowel is remaining vertical and is in constant contact with the torso. We want to have minimal torso movements. We want that to remain nice and upright. We also want to check that everything's remaining in the sagittal plane, so both the dowel, the feet, the knees, everything. There's no rotation, there's no swaying side to side. And we also want the front foot to remain in its contacted position, in its start position, and that the knee touches the center of the board. So for the FMS results, for the squat, I would give myself a score of 1 because I was not able to keep the dowel aligned with the foot. To help with this, I'll work on ankle mobility through foam rolling, as well as shoulder mobility through the static scarecrow stretch and dowel pass-throughs. The lunge, I was able to maintain contact and keep the dowel vertical. There wasn't a whole lot of torso movement. Everything remained in the sagittal plane, so I would give myself a result of 3. To help improve the posture, overall posture that we did earlier in the assessments, I would stretch the pecs through the static arm-on-wall stretch. I would include a runner's lunge to stretch out the hip flexors, a V-sit with a side bend to help stretch out the torso and help with the hip alignment, and I would use a lacrosse ball on the traps for the elevation.